Dr. Alidad Zadeh. He's our guest speaker tonight. Dr. Zadeh is currently an internist with board certification in internal medicine and is the premier patient care IPA president at the Imperial Valley Family Care Medical Group. Dr. Zadeh, we are happy to have you and we are all excited and ready to hear you.
Oh, wonderful. Okay. خیلی ممنون از شما. Thank you so much.
مرسی.
من بیشتر راحتم برای انگلیسی صحبت کردن. So thank you for allowing me to speak English and give my presentation in English. Let me take a quick minute and share my خیلی ممنون. مرسی. So first of all, I want to say that I was so excited and honored to be asked to do this talk. First of all, teaching has always been a passion of mine. Having to be able to give this talk to my own community and the Iranian scientific community and the professionals, it just gives me an extra pleasure. And I hope after we're done with this little short conversation and basically a topic, you're going to have a much better idea about this coronavirus, which unfortunately, has affected all of our lives, and it will continue to do so. And so from now on, if you do hear something and if someone asks you a question, you may be able to maybe answer those questions a little bit better and be more comfortable about certain things, including vaccination. So we're really going to talk about everything about COVID-19. I'm really going to go from A to Z, give you kind of an idea of what it is and how it presents and treatments, prevention, and what do we have to look forward to in the future? And how are we going to get out of this mess? I mean, that's the ultimate question. So COVID-19 is really a coronavirus. Now, it's not the only coronavirus. There are actually 6 versions of coronavirus out there. 4 of them have been around and we've been infected by them. They're the ones that cause the common cold. So this is not a new virus for us. 2 of them cause serious illness. And one of them is the SARS-CoV and the other one is MERS. SARS stands for Severe Aortic Respiratory Syndrome. MERS stands for Middle Eastern Respiratory Syndrome. SARS-CoV, which was the first SARS that came about, it came from an Asian palm civet. It's like an animal in Asia. And MERS came from camels. So what this tells you, and SARS-CoV-2, which is COVID-19, which is what we're dealing with now, came from bats, at least what we presume. So this coronavirus, the ones that we're dealing with, this is a pathogen that's a human and animal pathogen. And how we get it is because of the close interaction that humans and animals have together. So in this case, when it comes to COVID-19, we assume that it came from bats, and that's what we're dealing with. Now, how we found this virus is in 2019, all of a sudden we had a cluster of pneumonias in Wuhan, China. And then we were able to separate the cause, and we found out that it's a SARS virus, and we called it SARS-CoV-2 because it's the second version of the SARS. Within months, that virus has spread in the entire world. There are no countries that have been safe from this. And we have now over 100 million, just yesterday we passed the 100 million mark. We have over 100 million people infected with this virus, and over 2 million people have died. This is obviously terrible, and not only that, this is the beginning if we don't get things under control. Out of every 100 people that get it, 2 die. That's about a 2% mortality. That's bad. And one thing that I want to let you know is between SARS-CoV-1, SARS-CoV-2, and MERS, the one that we're dealing with now, COVID-19, which is SARS-CoV-2, is the most contagious. But thank God it has the lowest mortality. When it comes to MERS, the mortality rate is about 35%. That means out of every 100 people, 35 died. When it comes to SARS-CoV-1, it's about 10 out of 100 that die. When it comes to COVID-19, as you see, it's about 2 that die. So thank God for that, because imagine a virus if it was as contagious as COVID-19 and as high in mortality as the MERS. I mean, we would be. How does the COVID-19 spread? As we know, it's very capable of doing that. Well, it can spread through close contact from person to person. We know that. The spread can even happen if you're not in contact with each other and you're within 6 feet of each other. That's why all the rules are saying, try to be 6 feet apart from other people around you. That decreases the risk of you catching it from someone. The biggest problem with COVID-19 is it can be spread by people that are asymptomatic, which means you may look at me and I may have no symptoms. And you may say, well, he's healthy. I can be close to him. I can be in contact with him, and I could be actually contagious. The CDC estimates that maybe up to 60% of the spread is actually happening through asymptomatic mode. That's a big problem. So what I want you guys to do is, not trust that someone looks healthy. They could look great, and they could be very healthy, and they could still pass the virus to you. It can also, we know that it's actually spread through respiratory droplets. So when someone coughs, they sneeze, that could get you the droplets on someone else. That's the reason, again, for the 6 feet difference. And if those droplets land on a mucous membrane, eyes, mouth, nose, then the other person can get it. We know that it's more contagious than influenza, so it can more easily spread. And now when you look at the new strain of COVID-19, which is the B117, this new version is even more contagious than the original version that was around. So, but it's less contagious than measles. Measles has so far been the most contagious virus that we've ever dealt with. So we're kind of in the middle when it comes to COVID-19. And the last part is it can be spread through airborne transmission. And that's important to know, because if you're in a confined area, and let's say I decide that I'm a great singer and I want to entertain you, and I start singing out loud or laughing out loud, or I start screaming at someone in front of me, well, the droplets leave my mouth, that's one thing, but also little tiny particles that will stay in the air and float in the air. And those can then be inhaled by someone else, and then they can get the illness as well. This is the reason why we recommend that if you're going to get together where? Outside. Don't be inside, because if one person is inside with a bunch of other people that is causing an infection, they could give it to everybody else. So at least now, hopefully you have a better idea of how this virus spreads. And that's the reason for a lot of the rules that have come out to protect all of us. I'm going to keep looking also at my phone, because I was told that Mohammed John is going to be kind enough to text me some of the questions if there are questions that are being posted, so I don't have to play around with the screen. So excuse me if I look at my phone. I'm trying to see if there are any questions that are sent to me. If there are, I'll answer them. Please feel free to send the questions if you have any. This is a really good slide, because what it tells you is a little bit of timeline. What is the timeline? So for example, let's say you get exposed to the virus today. Well, what would you expect? Well, the first thing is the incubation period. Incubation period is the time period from the time you get exposed to the time you become symptomatic. And it could be, most of the times it's about 4 to 6 days, but it could be as long as 14 days. In some cases, it's even been longer than that. Usually at about 4 to 6 days, people become symptomatic. Now, once they become symptomatic, the symptoms last about 10 days. And then what the CDC really recommends is, well, after that, you want to, when the symptoms are gone, still wait about 72 hours, with no fever before you're actually allowed to be released from your quarantine and isolation. And one thing that I want you guys to really pay attention to here is this: the infectious period. As you look at the infectious period, you notice that it starts when? It starts in the incubation period, and it continues once the patient is symptomatic. And this is very crucial, because when you're in your incubation period, you have no symptoms. These are the asymptomatic individuals that are spreading the virus to everybody. So I have a question. The question is, how long does it take for a person from the time he or she gets the COVID to transfer a virus to another person? That's a very good question. So usually what we say is it takes about 3 to 5 days from the exposure before you can start being contagious. So that's also the reason I recommend that, for example, let's say today you were giving a ride to a friend of yours, and tomorrow you find out that that person is positive for COVID. This is happening every day. These are some of the common questions I get every day. And would you test that same day? Well, that same day, if you test, you're going to get a negative test, and that's going to be possibly a false negative test. You may have to wait 3-4 days after the exposure before you test yourself, because that's by then you have enough viral load in your system that, number one, you can be contagious. Number two, you will test positive with the current test that we have. So in reality it takes about 3-4 days after exposure before you are able to become contagious yourself. And then the other question that they asked is, which vaccine is better? I'm going to answer all those questions when we get to it, regarding the vaccine. So when you get, by the time I'm done, you're going to know more about vaccines than you ever wanted to know, so we'll go from there. So very key thing for this slide is just remember that asymptomatic carriers can cause almost 60% of the infections. So very, very key thing. So testing for COVID, since we talked about that. There are 3 different kinds of tests for COVID. There's the molecular test, there's the antigen test, and there's the antibody test. And it's really important that you know the difference. When you go to a facility and they do the rapid swab, which is they did a swab through the nasopharyngeal or the mid-turbinate or the oropharyngeal, which, by the way, I don't really recommend the oropharyngeal. I recommend either the mid-turbinate or the nasopharyngeal swabs. When you get swabbed, you're getting one of two tests. Either you're getting the molecular test or you're getting the antigen test. If the test results become available within 15 minutes to 20 minutes, that's the antigen test. And if they take about an hour or longer, that's usually the molecular test. Molecular test, the most common form of it that we see around, and that's how people know it, is the PCR test. This is the more accurate test. This is the most accurate test. And what it does, it diagnoses an active infection, because what it's looking for is looking for viral particles. So if you have virus in your system, then guess what? You're going to test positive with the molecular test. The antigen test also looks for viruses. It's just not as accurate, but it's faster in processing, it's cheaper in processing, and it's more widely available to everyone. The problem with the antigen test is that you can, in areas where you have a low viral load, and by that I mean not a lot of people have the COVID virus, you can get more false positives. And in an area where you have not that many, you have a lot of people that have the virus, if you test negative, there's a possibility that that test could be a false negative. So more false tests with the antigen test. So always ask, if you really want the best test for yourself, the PCR test would be the way to go. If you're not getting the PCR test, make sure if you get a negative test and you have high suspicion that you've been exposed and you have COVID, confirm that negative test with a PCR test. Now, antibody test is very different. Antibody test is a blood test. It really does not tell us anything about an active infection. All it does tell us is that if we have the antibodies to the COVID virus in our system. So what it does, it tells us if we've had a past previous infection. And it's really important to know for our bodies to really start producing antibodies, it could take anywhere from a couple of weeks to almost 6 weeks. So in reality is that if you're within the first 2 weeks, you're going to test negative with the antibody test, even though you may test positive with the molecular test, because you have the active virus, but you haven't built an immunity toward it yet. I try to do the antibody test about 4 to 6 weeks after an infection. It's very important for me. Number one, it confirms that they really had COVID. 2, it also lets me know that they have some antibodies now in their systems. And at least they have some protection against future COVID infections. And then there's another good question about the vaccinated individuals, and I'm going to go over that when I get to the vaccines. If I forget, Mohammed John would love it if you can remind me again of that question, so I don't forget. So what's the clinical presentation of COVID? You know, what are the most common things? Most common initial 4 symptoms of COVID. Number 1 is cough. 50% of the individuals have cough. Fever is number 2. Myalgia is the third one, and headaches is number 4. Less frequent symptoms are the nausea, vomiting, diarrhea, sore throat, loss of sense of smell or loss of taste. Or even pink eye can be a sign of COVID. So if you get a pink eye out of the blue and you're kind of like, oh, I don't know where I got that from, a good reason to get tested. My advice to everyone is the way we're going to get out of this quarantine, the way we're going to get out of this pandemic is if we have any suspicion that we have COVID, we test. If the test is positive, we quarantine. If the test is negative, and as long as we know it's negative, what I mean by that is if we use an antigen test, we confirm that with a molecular test, then we're free to go back to our normal life. That way we know that we don't have COVID. So it's really important to know these signs and symptoms. If you have any suspicion that you've been exposed, then you really want to go ahead and test yourself. Now, in some people, it gets more serious. They actually get what's called pneumonia. Now, I have to tell you, the signs of pneumonia obviously is cough, shortness of breath. That's what dyspnea is, shortness of breath, and fever. And when you get a chest X-ray on these patients, they have bilateral pneumonia. There was a period about 4 weeks ago where our hospital, I take care of patients both in the hospital and in the clinic, COVID patients and non-COVID patients. In our hospital, we were 50% over our maximum capacity. That means normally our maximum capacity is about 100 patients, and we're at 150 and plus. And out of those 150, over 90% were COVID patients. They all had the exact same presentation. Couldn't breathe, they had fever, cough, and their chest X-ray looked exactly the same with bilateral pneumonia. If anyone was a non-believer that this COVID is a real problem, I would have loved to walk him around the hospital and show him that in my history of taking care of patients, which I've been a physician now for over a decade, and I've never, ever seen an entire hospital filled with one type of disease. This is how bad this condition is. So out of those people with pneumonia, a percentage of them, about 1 out of 3 of those pneumonia patients, they become critically ill, which means then they have to go in on a ventilator. It could be an intubated intubation, or it could be a positive pressure, non-ventilated ventilators, like a BiPAP or things like a high flow nasal cannula. These patients then become critical. Out of those critical patients, 1 out of every 5, they become very, very critical, and they mostly die. I have rarely seen people that get intubated that come out of intubation. Maybe I would tell you out of every 20 patients that get intubated, 1 survives. It's very, very sad. You know, we used to sign death certificates for maybe 4 or 5 patients a month. Now we do 30, 40 a day sometimes. It's just been crazy. So again, this is a very serious disease, can be very serious for that 2% that really get the bad version of this disease, and they could end up not surviving through it. So what's the mortality of COVID-19? You know, we have over 400,000 confirmed deaths right now. And that's in United States. And sometimes people say, well, this is, don't listen to that, because there's a lot of conspiracy theories out in the public that anybody that dies from anything, guess what they're slapping on their death certificate? It's COVID, because the doctors get paid more and the hospitals get paid more, and doctors don't get paid more, number one. I know that for sure. And thank God for that. Hospitals may get paid more. The reason is the patients that have COVID, when they come into the hospital, they don't leave for up to sometimes a month, month and a half. So the hospitals better get paid more for that additional length of time that they're taking care of the patient. But the way we know for sure this number is correct is by looking at something called the excess death rate. This is a very important number. What excess death rate is the observed death rate compared to expected death rate from previous years. And what we found is that when you look at what we anticipate, how many people we anticipate dying based on usual causes, this year in 2020, we had 400,000 more people dying than that baseline. That is our excess death rate, which tells us one thing, that 400,000 number of deaths due to COVID is correct. Because before this year, we didn't have COVID. The only thing that's changed this year is that COVID. So 2020 was the deadliest year in the United States history, deadliest year. And I hope 2021 is going to be a much better year for us. Hopefully it will not get worse. So what are other complications of COVID? And I have a couple of good questions. Let me see here. Let's see. And we'll talk about how maybe people can get vaccination sooner. I'm going to give you some ideas on that. How long does the antibodies last? That was a question that was asked. That's a great question. The antibodies, after you get an infection, in 40% of individuals with mild disease, goes away completely. This is a problem. That means you could have the COVID infection and you may think to yourself, I am protected. But within 6 months, your antibody levels go almost to non-existent, non-detectable, which means your protection may not be there. And so therefore, there's a risk of reinfection. So this is why when it comes to vaccination, we'll talk about this, that I do recommend vaccination, even if you got the COVID infection. That's a great question, by the way, whoever asked that. So thank you for that. Other complications are called COVID-19. And when I say other complications, besides the obvious, what's the obvious complication? Respiratory, pneumonia, respiratory failure. Besides that, cardiovascular complications, heart attacks, arrhythmias, they go into cardiogenic shock. And the reason for that is that thromboembolic events increase. And what thromboembolic events are, in more layman terms, is that what COVID virus does is it makes the blood thick. And because of that, you start forming a lot of little clots everywhere. When they've done autopsies on people that have died from COVID, they find clots everywhere. And so those clots can be in your veins, which can cause DVTs or deep vein thromboses. They can be in your lungs, causing pulmonary embolism, causing lungs to die, or it can cause stroke. And this is I've seen this before in my own eyes, individuals that are less than 50 years of age with no comorbidities, and they get COVID, and then what happens is they end up with a stroke afterwards. So, one of the things I do for my patients when they have COVID is I always add a baby aspirin to their regimen of treatment. And the baby aspirin is to make the blood a little thinner to kind of fight this complication. Other complications are neurological. It can cause encephalopathy, confusion for the patients, inflammation. These patients come in with super high inflammatory markers. In kids, it can cause Kawasaki disease, and then secondary infections. And the reason for the secondary infections is that once the COVID vaccine attacks the organs, including, let's say, the lungs, the protective layer is gone. Once the protective layer inside the lungs is gone, now bacteria can get in much easier. Fungus can get in much easier. And that's how most of the people die from COVID. It's not the COVID itself that kills them. It's that COVID destroys the organs, and now the bacteria and fungal infections can get in, and that can cause them to die. So when you look at where COVID virus is, when you look at people that have died from it, it's almost in every organ: kidneys, liver, lung, heart, brain, in all the organs. So it's not a lung problem. That's the key thing I want to make sure everyone gets from this slide. This is a systemic problem. COVID causes systemic issues for everyone. Okay. And then one of the good questions was asked is, how can a person survive from pulmonary embolism? So the way we treat pulmonary embolism is we put them on very strong anticoagulants. And what that anticoagulant does, it makes the blood super thin. And what that does over time, it dissolves the blood clot. So I have had many patients that had pulmonary embolism under my care, and I was able to treat it, and they were able to survive that. Some didn't, but a lot of them did. So it is treatable. Next, another topic that keeps coming up, these are the questions I get asked all the time, by the way, is that, hey, does my blood type matter? I've had so many patients ask me now, hey, can you check my blood type? I'm like, the insurance is not going to cover this. If you want to pay out of pocket, I can. And the reason is because there is a difference in your blood type and how you respond to COVID, most likely. There was a study that was presented in Annals of Internal Medicine in November 24, 2020, that found that patients with blood type O and the blood type rhesus negative, which is O minus or anything negative, they have a lower risk of infection with COVID and lower risk of complications from COVID. So really, if you're O negative, you're in best possible situation. And if you're B positive, you're unfortunately the worst case scenario. These patients have the highest risk of getting the infection and actually the highest rate of complication. And if you, just to give you an idea what the difference is, with the patients that were O, they had a 2.1% chance of getting the infection, and the people that are type B plus had 4.2% chance of getting the infection. And so it's almost double. So there may be some correspondence between your blood type and how good or bad you either get the infection, how you deal with the infection. So unfortunately, nothing you can do about that. You know, it's what God gives you, and we're stuck with it. So I wouldn't worry too much about this. Question is, well, let's say now you've learned that what the presentations are of COVID. You've learned that the minute you feel anything that gives that suspicion to you that you could be having COVID infection, or you've been exposed and you're waiting 3 or 4 days afterwards, you get tested. And the minute you become positive, now what do? I just tested positive. You know, this is something that's happening all over the United States right now. And the good news and bad news is there's not a lot of medications that work. And, you know, I have to be very honest. And you talk to different doctors and they have their own basket of goodies that they want to give you. And they say, this is going to work. Amazing. But the reality is there are only 3 things that work. Only one thing works 100% that we know for sure. If you have not been hospitalized yet, that means you're not that sick yet, but you are at risk for becoming very sick. And that's monoclonal antibodies. These are synthetic antibodies against the COVID virus. And it's an IV infusion. And what we found is that people that get the monoclonal antibody, their risk of becoming hospitalized is reduced by almost 67%. This is amazing. This is a great thing. I hope more physicians begin to use this. Now, not everyone can get this. There are very strict criteria for getting the monoclonal antibody. One is you have to be the president of the United States. Donald Trump got it. You know, that's the brand name for it was Regeneron. But if you're not the president of the United States, then the way you get it is either you're over 55 with comorbidities or you're over 65. So younger, healthier people that don't have any comorbidities will not qualify for this the treatment. But people that have comorbidities will. Now, what happens if you miss the chance of getting this, and then now you're one of those few unfortunate people that get more sick? 15% of people, that 10 to 15% of people that get the coronavirus can get really sick. And you're now in the hospital with pneumonia. So what helps in the hospital is 2 things, remdesivir and dexamethasone. Remdesivir is basically an HIV drug, and what it does, what is shown is it actually causes speeding of the recovery. It really doesn't do much with the mortality, but it does is decreases the hospitalization. So you're in the hospital less, so you get healed up faster. Dexamethasone, which is a steroid, and I say dexamethasone, but really any steroid will work. This one actually decreases mortality in severely ill patients. So all my patients in the hospital, they're on remdesivir and dexamethasone. I treat them with what I can. What's more important for public to know is what medications don't work. And because there's so much false information out there for the public, it's hard to know, what do I believe? One doctor is going online, going to the Senate and telling me this works, and another doctor is saying it doesn't work. Well, I'm not going to tell you what doesn't work, because in reality, we don't know for sure. But what I can tell you is, based on the randomized controlled trials, these are the trials that compare a treatment with placebo in a double-blinded study where neither the patient or the provider know if their patients getting the treatment or not. These medications have not shown any benefit. So basically, they work just as good as sugar pills. Number one is hydroxychloroquine. So my recommendation is don't get it. If your doctor even wants to give it to you, I wouldn't get it. The other one is the convalescent plasma therapy. Sorry for the misspell there. Convalescent plasma therapy in severely ill. We used to think that works. That's the antibodies from someone that already had the infection. We get their plasma and then we give it to the patient that's really sick. And we thought that's going to help them, but it doesn't really work. The newer studies are showing there's no benefit. And I believe the reason is that when we get the virus, what happens with the virus is the viral load starts going up. And then at some point it reaches its peak. That is the point where you become symptomatic, because at that point you have a lot of virus in your system and they're causing a systemic problem for you, especially the lungs. As the body realizes this, it starts fighting it and the viral load starts to come down. And so eventually the virus starts going to becoming almost zero. But now what you're dealing with is the sequela of that, all those viruses that were initially in your system were causing you issues. And so it's an inflammatory process that's causing the damage, not the virus itself. So if I wait till someone is severely ill, by that point, their viral load probably is very low. So giving them plasma from someone that has the antibody, well, it's not going to make much of a difference. Really, probably the convalescent plasma therapy will work much better if you give it to people that are not very sick and they have just got symptoms and they're at risk of becoming sick later, just like the monoclonal antibody. That's why that one works the best, because we can give it outpatient to people before even they get sick. The other one is the lopinavir, ritonavir. That's another HIV medication. There were hopes for this medication, but it hasn't really panned out. And then finally is the tocilizumab. We always think that interleukin-6 is one of the inflammatory markers and one of the things that causes inflammation. So we thought if we inhibit it, that will help the inflammation cascade that's happening with COVID. But again, the studies have shown otherwise. Sometimes things make sense theoretically, but when you actually put it into life and into practicality, they don't show the results that we want to see. Example was hydroxychloroquine. Hydroxychloroquine in test tubes, it seemed to block the virus and it seemed to work. But when we actually put it into randomized controlled trials, we got no benefit. And so because of that, there was a lot of confusion. Well, what do we go with? And instead of giving you all bad news, let me tell you about some good news. Here are some medications that are showing a lot of promise. Again, we still don't have enough randomized controlled trials to tell you for sure, but they're showing a lot of benefit. One of them is Ivermectin. This is an anti-parasitic drug. And the other one is colchicine, which is a gout medication. And they both are showing a lot of promise that they could actually help patients before they get very sick. So hopefully soon enough, we're going to have few different things that we can give to patients before they get so sick to help them not get sick. So let me see if I have any questions on these before I move forward. Does all hospitals have Regeneron? All hospitals should be getting some monoclonal antibodies, either Regeneron or another one just like it. And you need to talk to your hospitals, but most hospitals did get doses and they're continuing to get doses. A lot of physicians don't know about this, or they don't know how to go about ordering it. So remember, if you get a patient in your office and you're a physician or you're a patient that you're high risk, The minute you test positive and you know you're one of those high-risk people, overweight, diabetic, hypertensive, older, any of those things that put you at higher risk, immediately go to your physician and say, find me monoclonal antibody infusion at one of the hospitals around, and I'll go there and get it. Okay, so yes, most hospitals should be able to get it for you. Good question. So let's say you got the COVID. So you got the COVID, either you got the monoclonal antibody or you didn't. Either way, you hopefully didn't nothing horrible happened to you. What is the time to recovery? For mild infections, it's usually about 2 weeks. So within 2 weeks, you should be fine. Sometimes there are certain things that linger on, and we'll talk about those. These are things, the sequelas of the infection that continue on afterwards. But if you had the severe disease, if you had the pneumonia or you had respiratory failure and you were in the hospital, sometimes the recovery can be 2 to 3 months. I mean, I have patients right now under my service that have been in the hospital for 40 days and have not improved or gotten worse. They're intubated and they're continuing the same. And we just have to give them time. Sometimes, if they're younger, we even bypass the lungs with this machine called the Ecmo machine, just to keep them alive long enough for the lungs to recover, because it may take a couple of months, 2 to 3 months before the lungs recover. So in mild infections, couple of weeks. In more severe infections, it could be up to a few months. So what are the sequelas? After I'm done with my infection, what are the things that may linger on? Fatigue is one of the main things. People that have had COVID, you talk to them afterwards and they all complain about, I just don't have the same energy I used to. Shortness of breath, that could linger on for a while, especially if you had a little bit more respiratory involvement. Chest pain with deep inspiration. When you take a deep breath, sometimes you can get some chest pain with that. The cough can linger on, for even up to a couple of months. And one of the big things that happen is cognitive deficit. And they even gave a name to this. It's called the post-executive syndrome. And so it basically, you have a little more difficulty doing your tasks. You're more forgetful. The words don't come so easily to you. And the good news is all of these sequelas, I would say almost all of it, almost 100% of times, eventually as time goes by, they will be resolved. So there's hope that, even if you're having some of these symptoms, that if you wait long enough, it'll go away. But there are a few individuals that it stays on them long enough. There are individuals that have had the infection 6 months ago and they still are suffering from some of these sequelae. You just never know. So if those are some of the sequelas, if 2 out of 100 people can die, if 10 to 15 can be hospitalized, well, we don't want to get it. How do we prevent ourselves from getting this virus? Number one is social distancing. And that's the reason for that is when we talked in the beginning, that 6 feet, keeping that 6 feet social distancing, wearing masks. We'll talk about that in a little bit. Hygiene, washing your hands. People are doing way better now at the social distancing, the mask and hygiene. And I say that because this last year in 2020, we had one of the best years when it came to influenza. We had the least amount of deaths from influenza, least amount of influenza infections. So the social distancing, the prevention methods that we're using is working. Now, they're working, but obviously they're not working great, especially with now we have this UK strain, the B117 strain that's now out. There are other strains which we'll talk about. They're very contagious. So people, even though they're following the rules, we're still seeing tons of people getting infected every day. So how do we really prevent? Really, the only way we're going to get through this pandemic is vaccination. That's the next thing we're going to talk about. And the vaccination is going to be truly important for us. This is a nice slide about, the things that we can do to prevent the virus. Obviously, washing hands is going to be important. Wear a mask, stay 6 feet apart. That's, and it doesn't say it in this slide, but try to be outdoors. Remember the airborne transmission. So, as you can avoid it, try to not be with too many people inside the closed space. Here in this slide says use a cloth mask. You can use any mask. What we really want to do is save the N95 mask for the people that are in the health field. because they're the ones that are going to have to really be confronted with people that are and be in close contact with them that are actually sick. But at this point, we're getting much more masks out, so everyone should be able to wear more than just a cloth mask. Cloth mask, if you're going to wear a cloth mask, make sure it's a double layer, because otherwise it's not very effective. But still better than none. So if you have just a cloth mask, wear it. And follow food and safety guidelines, of course, when you get groceries. If you do get the COVID infection, maybe afterwards donate blood and plasma. This will allow us to separate antibodies from someone that's building it, and possibly in the future have a way to give it to people before they get super sick. And then, of course, report any fraudulent things. There's so many fraudulent things happening with people that are reporting testing, where they do finger pricks to test you to see if you have COVID. There are tests that are finger prick tests, but that's a blood test. That's an antibody test. Remember, the antibody test cannot be used to determine if you have an active infection or not. It can only tell you if you've had previous infections. So if a doctor is using that to clear patients from COVID, this is fraudulent. These are things that you want to report, so we can stop those things, because that can cause a spread. If a doctor clears a patient that's not really supposed to be cleared, and then they go into their workspace and give it to everybody else. So make sure you keep good communication with that. So let's talk about the hot topic right now, which is vaccines. When it comes to COVID-19 vaccines, there are about 170 plus companies right now that are working on building a vaccine. There is almost 50 of them that are going through the clinical trials right now. So in the near future, there's going to be so many vaccines that are going to become available to us. Every single person can get a vaccine, and you can get the one that you really want to get. Currently, only 2 of them have emergency use authorization from FDA. One is Pfizer from BioNTech, and one is Moderna. There's one that's close to getting emergency use authorization, and that's AstraZeneca. But we won't talk about AstraZeneca yet because no one can get it. It's not approved yet. And they're going through some difficulties from their studies. So I would say the focus should now be on Pfizer and Moderna vaccines. Both of these vaccines are mRNA vaccines. And the way the mRNA vaccines work is basically they take the messenger RNA, which is basically the code to making a protein, and the protein it codes for are going to be the spike proteins on the coronavirus. And this messenger RNA is encapsulated with fat, which is basically like a capsule. And inside the capsule, there'll be some sugar and salt, basically. And this is basically how this vaccine is given. The messenger RNA then enters the cells. Inside the cytoplasm of the cell, the messenger RNA is worked on by the ribosomes and the ribosomal units, and it makes the spike proteins. These spike proteins are then released into the blood. Well, the body says, oh, I don't know what these are. These are new proteins to me. So what the body does, it produces antibodies toward these spike proteins. And when the antibodies are made and available, when you actually get the real coronavirus with the real spike proteins on it, then the body's already ready and immediately can attack it, and they can destroy the virus before the virus reaches that peak where it can do a lot of damage. And that's the whole point of this. So these vaccines are amazing. They in the studies that they were done on there, they had 100% effectivity in preventing serious illness. So basically, not one person had a serious disease that got the vaccine. It had 95% effectivity in preventing infection, which means still 5 out of 100 people that got the vaccine got the infection, but none of them became serious infections. This is fantastic. This is good for us to know. And there was no serious adverse reactions. This is really great news. And so we have basically 2 vaccines within a year that are 95% effective, and they're relatively very safe, at least short term. I cannot tell you they're safe long term because we haven't studied it 5 years down the line. We will know the long-term effects in 2, 3, 4, 5 years. But they appear to be, at this point at least, safe short-term and hopefully long-term. Now, when it comes to vaccines, there is a lot of myths, and people really hold on to these myths to prevent themselves from getting vaccinated. There are conspiracies out there. There are all these experts that are coming out and saying things that are not true. And people, of course, gravitate toward the extraordinary facts, and they cling on to it and say, I told you, and this is it's a terrible vaccine, and Bill Gates is going to microchip all of us, and we're all going to be, in trouble. And first of all, bad news for everyone is Bill Gates has already microchipped all of us, and it's called the cell phone. And they know everything about you based on your cell phone already. They don't need to go through the extent of putting a microchip in you through a vaccine, which is not possible. So let me go over these myths, because this is going to be a crucial thing for us. The number one way we're going to get out of this pandemic is for enough people to get vaccinated. So we want to make sure everyone feels comfortable about the vaccination. And that's why these are important. Number one, the mRNA vaccine will change our DNA. This is a completely false statement. The mRNA never enters the nucleus where the DNA stays at. On the cytoplasm, which is outside of the nucleus, is worked on by the ribosomal units, makes the protein, and within a day or two, it's destroyed and gone. So your DNA never changes. So you are not going to grow horns. You're not going to grow a tail. It will not happen, I promise you. You can call me directly if that ever happens to you. You'll be an anomaly. Number two is, we can get the infection from the vaccine. Well, that is absolutely, again, false. The way these vaccines, these mRNA vaccines work, is they program the cell to make spike proteins. These are the little spike proteins on top of the virus. In order for a virus to infect you, you need the spike protein, you need the capsule, you need the genetic information inside of the virus. And the vaccine will not give you that. So there is absolutely zero way that the vaccine will cause you infection. Zero. The next one is, it can cause infertility. And again, this came out because there was an expert that put something online that said, well, the spike protein on the virus resembles a protein that's very important in development of the placenta, and it's called syncytin-1. And if you make antibodies against the spike protein, you're going to make antibodies against syncytin-1, and that will lead to placental malfunction, and therefore it will cause infertility. Well, first of all, the spike protein and syncytin-1 are very different. They are not the same. That's one. Two is, let me be very frank with you all. We have two choices as the future months to come. Either we get the vaccine or we get the COVID virus itself. And I'll tell you, with the way that people are getting it, they're sick and they're contagious and getting it to each other, and all these new strains that are coming out, they're even more contagious. If this spike protein that the vaccine is producing is going to cause you infertility, that same spike protein lives on the virus. So when you get the COVID itself, guess what will happen? You will also get that infertility. I just told you over 100 million people have got the COVID infection. We have never heard of COVID infection causing infertility. Well, if COVID infection doesn't cause infertility, then the spike protein on top of the virus will not cause infertility. Here's the other myth. If I already had the COVID, well, then I don't need the vaccine anymore. Well, we already talked about this. If you have mild symptoms, even sometimes people that have maybe more than mild symptoms, after a few months, your antibody levels may go down to non-detectable. We know reinfections do happen. Sometimes they're worse, sometimes they're milder. So in reality, it's very important that even if you had the COVID, that you still get the vaccination. The next one, researchers rushed the development of the vaccine, so its safety and effectiveness cannot be trusted. This is, again, a very false statement. The way I want to give you an example is this. If you talk about 50 years ago and you wanted to do any kind of calculation or anything like that, you would have to use computers that were almost as big as our rooms, and it was very difficult to process. They were very slow. And you compare that to now, where one cell phone has a higher processing power than those huge computers 50 years ago. Well, if the technology has become so advanced when it comes to computers, imagine the same progress happening when it comes to medical field. So we have much higher scientific abilities now. We can make things faster. We can process it faster. We can come up with the genetic code of the entire virus within a few months, a few short months, which is exactly what happened by China. China then can make that information available for all these companies, which then used it to form the messenger RNA vaccination. Now, the messenger RNA vaccination, mRNA vaccines altogether, this is not a new concept. The mRNA technology has been around for more than 2 decades. We even used to use it for the Ebola infection as a vaccine for that. So in reality, this is new technology, much faster processing. On top of that, they were able to do all the clinical phases parallel to each other at the same time. And that allowed us to speed things up. And then furthermore, in order for us to be able to know if the vaccine works or not, or if it's effective or not, we have to have people that we can enroll into the studies. Well, because we have so many patients with coronavirus, it was so easy to get people to enroll into the studies, so the studies went much faster. What I like to tell you is there has been no lapse in being careful with the studies. And in all the studies, there were no serious side effects, so the safety was tested. And these vaccines are 95% effective in preventing infection and 100% effective in preventing serious infection. So in reality, the research is very solid. You cannot go against that research. The next myth, getting COVID vaccine means I can stop wearing my mask. First of all, when you get the COVID vaccine, you still can get the infection. Like I said, 5% of the people can still get the infection, but it will be a mild infection. When you have the infection, you can still spread it to other people. So in reality, just getting the vaccine is not going to allow us to take off the masks. The only way we can take off the mask is that we eliminate the virus to the point that is so small around us that then we can take off the mask, all of us. And that will come when we have herd immunity. And we'll talk a little bit about that. In order to reach herd immunity, we really need a good percentage of people to be immune to the virus. The next myth, the side effect of the COVID-19 vaccines are very, very dangerous. Well, again, we are vaccinating right now about 900,000 people a day. If there were people having serious side effects, and with the reach that social media now has, wouldn't you think that it'll be all over the internet if many people are having serious side effects? There are some side effects that have come up. For example, some people get Bell's palsy. But when actually they looked at that and they said, okay, if there was no vaccine given, how many people in the population would get the Bell's palsy? And they found out that the number of people getting it after vaccination and the number of people that would naturally get it are about the same. So therefore, they couldn't really say one was the cause of the other. And then there has been one serious death and someone that bled in their brain because they had low platelet count, secondary condition called ITP, which is idiopathic thrombocytic purpura. And with ITP, which is an autoimmune condition where your platelet count starts to drop because your own body attacks it, this happened to that individual weeks after he got the vaccine. We are not certain if that happened because of the vaccine or if it would have happened regardless, because ITP used to happen before the vaccine. It happens naturally in some people. So again, 1% with the ITP, few, less than a handful with Bell's palsy, and millions of people are getting vaccinated. What is that equal to? Very safe vaccine. And then, as I mentioned, the last myth is technology of mRNA vaccine is brand new. As I already mentioned, it is not brand new. It's been around for over 2 decades. So this is not a new technology. It's a 2-decade-old technology. And now we're able to apply it really nicely to COVID virus. And let me make sure that there's no question here. Okay. There was a question that says, I was told Zithromax is helpful. Is this true or not? So what they've theorized is that azithromycin or Zithromax, if given with zinc and hydroxychloroquine, can again help people so that they don't get so sick. And when there was a randomized controlled trial on that, it showed no extra benefit. Now, there are some possibility that azithromycin itself can help with blocking the virus from entering the cell. This has not been proven, but guess what? Putting someone on azithromycin is very low risk. So do I put my patients that are sick with COVID on azithromycin? I do, because even if it may not cause a lot of benefit, the harm is very little. So I either use azithromycin or doxycycline, and those are 2 antibiotics I use. Again, this is not because of hard science and research says that this will really help the patient, but I say to myself, the risk is very little. If it helps the patient, great. If not, then I'm not doing any harm. The next question is, does the antibody that's produced against the spike proteins in our body after we get vaccinated, will that interrupt or disrupt our other organs in our body? Can it then attack, for example, the heart or the lungs or the joints? Well, the answer to that question is that is always a possibility that it could. Because when you introduce a foreign thing to your body and the body starts making an immune response against it, that immune response can become almost sometimes in some individuals out of proportion, and then it can damage other organs. So this is something we've seen before in other conditions. But again, here's what I tell everyone about that. If that would happen with the coronavirus vaccine, that same thing will happen if you got the COVID infection itself. So again, you have a choice. You'll either get the vaccine, or eventually, if you don't get it, and not a lot of people get it, and it's all around us like it is, you'll get the COVID infection itself. And if you get the COVID infection, you're still making the same antibodies to those spike proteins. So if those antibodies are going to attack other parts of the body, they'll do it either because you were vaccinated or because you got the COVID infection. My recommendation is, if that's going to happen to me, I'd rather get it through the vaccine, because I know the vaccine at least won't kill me. But if I get the actual COVID infection, I could get hospitalized, and 2 out of 100 people can die. That cannot happen with the vaccination. So that's a great question. What if you're positive with, that's another great question someone asked, is if we test positive, can we get the vaccine 3 weeks later? CDC guidelines recommend that you wait 90 days after you get an infection. There is no science behind this. So in my answer to you is, if you get the infection after 3 weeks and you have the vaccine available and there's plenty of it around, you can get the vaccine and it will not cause you any harm. The reason that the CDC came up with these guidelines are to buy time. Because if you already got the infection, the chance of getting a reinfection within 3 months is very, very, very low. So why would you get a vaccine now instead of 3 months from now? Allow the short supply of the vaccines that we have currently to go to the people that haven't got the infection yet. So we can vaccinate them first, protect them, because you already are protected. Now, there is an exception to that rule. The exception is if you receive the monoclonal antibodies. Remember the one treatment that actually works before you get sick? What the recommendation is for that is you really then want to wait the full 90 days as the CDC recommends. And the reason for that is that if you have those antibodies floating around in your system and you get the vaccine and make those little spike proteins, well, those antibodies can neutralize some of those spike proteins So your body then will not make the right immune response against the proteins. So for that reason, you want to wait long enough for all that monoclonal antibody to be out of your system. And 90 days would be a very safe period, more than safe, for all of that to go out of your system. And that way you're very safe to get the vaccine afterwards, and you get the full effect of the vaccine at that point. So yes, you can get it. You can get the vaccine even after an infection. There's no law or hardcore fact that says why you can't get it. But I would say this: if you just got the COVID infection, wait 3 months. Let's allow the short supply of the vaccines to go more toward the individuals that are not protected, because you right now are protected. And you will be protected for the next 3 to 6 months. Let's get all the 65 and over individuals that are not protected, get them protected, and then in 3 months, we can get the vaccination. Hope that answers that question. And then the other question was, is the vaccine recommended for patients during chemotherapy? Absolutely. You know, I don't care if you're immunosuppressed. I don't care if you don't have a spleen. If you're on chemo. This vaccine will not harm you, because this vaccine is not giving you a weak live virus. A weak live virus, which is called an attenuated virus, those vaccinations cannot be given to people with compromised immune systems, because then those weak viruses can then sometimes cause an infection and cause problems. With the mRNA vaccine, you're not getting the whole virus. You're just getting the spike proteins. So there is no way, I don't care how low your immune system is, there's no way for you to get an infection from that. Now, if your immune system is very weak, you may not make a good immune response against the vaccine. So it may not work very well for you, but it will not harm you, and it will definitely help you. So that's a great question. The other question is there any research from Johnson & Johnson out? Absolutely, there is research out on Johnson & Johnson. It's still not complete. It still has to complete completely and then go to the FDA to get approved. So even with AstraZeneca, the research is not complete yet. So really, when it comes to complete researches, the only two that we have right now is Moderna and Pfizer. As more of the companies come out with their complete researches, I will continue to post things. I do it through my Facebook under Dr. Alida Zadeh. You're more than welcome to go there and watch some of the videos that I'll post the new researches that come out. Because when it comes to COVID, every day is a new fact that comes out. So just FYI, this is not something that's stagnant. It's a very dynamic process. So light at the end of the tunnel. I see a light at the end of the tunnel, especially when it comes to vaccination. How do we end this pandemic? Really, the way we end the pandemic is by reaching the herd immunity. And to reach herd immunity safely, you need to have 80% of the population immune. We already told you about 100 million, well, actually not 100 million, but about 25 million people in the United States have already got the infection. That's about 10% of the population. So that means we need an additional 70% of the population to get vaccinated or infected to reach that 80% total. Now, my choice is don't get infected, get vaccinated. Because when you get infected, you could be one of those unlucky people that get hospitalized or die. But if you get vaccinated, there's zero chance of you dying. So I would say I'd rather reach the herd immunity through vaccination than through infection. But one way or another, because of how contagious this virus is, we will reach herd immunity. And I just really hope that it's through vaccination. Right now, we're vaccinating about 900,000 people a day, especially for the month of January. That's how we've been doing it. So we're doing well. But we need to ramp it up more. The goal needs to be about 1.5 million vaccinations daily. If we can get to 1.5 to 2 million vaccinations daily, the other 200 million people in the United States will be vaccinated within 100 days. And that is what President Biden's goal is, to in the next 100 days to get everyone vaccinated. So I'm really looking forward to that. But there are obstacles to vaccination. Number one is limited supply. We were told we're going to get more vaccines. We got less. So there's a shortage. Other one is many non-believers in vaccine because of social media. There are a lot of fake news and facts, fake facts that are out there and people are clinging onto and saying, that's why I'm not going to get the vaccine. Well, if a lot of people believe in not getting the vaccine, then we have to reach the herd immunity through infections. And then that's going to be a lot more problematic, because once the whole medical system is overwhelmed, then people start dying in their homes. This is what's happening in other countries. And we don't want to get to that point. So I really hope that we actually reach the herd immunity through vaccination. Hopefully today's talk has kind of made some of those non-believers into at least, hopefully, some believing of the vaccination. Vaccines are not 100% effective. They're 95% effective. So again, just remember, if you get vaccinated, that doesn't mean you have the Superman sign on you and you can go out and do whatever you want. There's still 5 out of 100 that could get infected. And so the good news is it's 100% effective against severe disease. And then vaccinated individuals can still carry the disease. So doesn't mean that because you're vaccinated, you can't spread the disease. So just remember that. And then the final thing is, as coronavirus goes through me and then I spread it to someone else, the virus continues to mutate. This is a normal process that happens to every virus. And in some cases, when it mutates, it becomes less contagious and less deadly. In some cases, unfortunately, it can become more contagious and more deadly. And so in recent months, we've heard a lot about these new variants of COVID, and I just want to spend just a couple of minutes on them. The one that we've heard a lot about is the UK strain, or the B117 strain. And this one appears to be 70% more transmissible, 70% more contagious than the original COVID-19 virus, and possibly 30% more deadly. Now, the studies that tell us this more deadly, they're very weak studies. So we're not sure about the deadly part yet. The good news is we know that the vaccines still work against it. So that's, again, good news. The other strain was the South Africa strain. Now, South African strain is also more contagious. But one thing about South Africa strain is that it produces a chemical that actually suppresses the functioning of the antibodies. So it can cause the vaccines to possibly become less effective. But Moderna has done studies and has found its vaccine to still be effective against it. And Moderna and Pfizer are both working right now on coming up with booster shots. So you will eventually get booster shots for all these new variants. So that way, not only you're protected against the original virus, but you're protected against the new variants that are coming out. And then recently, we've had a few cases that's called the Brazil strain, and it's really similar to the South African strain. Life after pandemic. Here's what I want to assure you. This shall pass. We will get through this one way or another. We will. A coronavirus will most likely never be gone. This will become part of our lives, like the influenza that we deal with year to year. Eventually, COVID infection can morph into a seasonal disease, just like influenza. And the reason COVID caused so much problems because it was considered a novel virus. It came from a bat. Our human beings had never seen it before, so we didn't know how to fight it. Well, eventually, when it becomes more spread and everyone's been exposed to it, it becomes more of an endemic virus, no longer a novel virus. And once it becomes endemic virus, then it becomes maybe another common cold. So there's hope for that, as time goes by. Through vaccinations, through infections, all of those things, eventually becomes an endemic virus. And as I mentioned before, Moderna and Pfizer are both working on those booster shots for all these new variants that are coming out. So possibly every 2 years, that's what they're predicting as of now, that you would need to go in and get a booster shot. So that's the end of my presentation. I apologize for going over about 12 minutes, but it's your fault. You give me the microphone to talk and I can't stop. But thank you so much for being part of this and listening to me. I open it to any questions anyone has. Thank you.
Thank you, Dr. Zadeh. It was unbelievably good. I really enjoyed it.
Oh, thank you.
All the slides, all the questions you took. I think there are more questions in the chat.
Yeah. Let me go ahead and look here. Question is, do we need to get the vaccine every year? As of now, CDC is anticipating that the vaccines will be given every 2 years. We think the vaccine that we're getting now should be good for the next 2 years. Now, having said that, if we get a lot of like the South African strains like that are coming out, then we may have to give a booster shot earlier. So as far as now, 2 years, but that could change. The next question is, why in some Asian countries, less people get COVID? Do they have antibodies in their blood from the past? Well, you know, first of all, it's hard to know what is happening in some of the other countries because we cannot say for sure that everything is being reported the same way. Maybe things are not being reported 100%. It's possible they are and possible they're not. Plus, there is a difference in mentality when it comes to some of the other countries, like the Asian countries. When the law comes into as a mandate that everyone has to have social distancing, everyone has to wear a mask, people follow completely to the T. When it comes to the United States, you know, we have, you know, I don't want to judge us, but we have a little bit of sense of entitlement. And some of us, they don't believe in the vaccines. Some of the same individuals, they don't believe in wearing masks. Some of the same individuals, or maybe others, don't believe in social distancing. If you have enough of those people out and about, well, guess what happens? Then we're going to pass it out to everybody. And that's one of the reasons the United States has done so poorly when it comes to managing the COVID infection. And this even came from the president. You know, even the president initially didn't think this was going to be such a serious thing. So he didn't come down on this and say, this is a serious virus. Everyone needs to wear a mask. I'm going to wear a mask. I'm the president of your country. I'm going to wear a mask. In many of his speeches, you know, he wasn't wearing a mask. And I don't blame the president. I don't blame some of these individuals that are having doubts because there's so much fake news out. There's so much fake facts out that you don't know really who to believe. And so it's hard to know what is the truth and what is not the truth. But the reality is, if we can change our mentality, if we all follow those social distancing rules, the masking rules, the hygiene rules, if we all start getting vaccinated when it's available to us, then we're going to notice a big decrease in our number of COVID cases, just like other Asian countries, you know, and, you know, that's all I can say about that. The other question is there any trick to get vaccination earlier? So there are no tricks, but there are places that you can go to. As of now, if you're a healthcare worker or you're over 65, you can get the vaccine. So if you fall within that category, here are the places you can go. You can find rural health clinics in your area. They will have the vaccine. You can go to public health and put your name on the list and you can get the vaccine there. You can go to hospital clinics and hospitals and they will provide vaccines. And some of the primary care providers like myself will eventually have the vaccines. Pharmacies are now coming on board with vaccines. CVS, some of the local pharmacies are starting to have it. So in the next week or two, you should have multiple places. If you fall within that, the phase, you know, that you're allowed to get the vaccine, to be able to go ahead and get the vaccine. Now, they're also coming down very strictly on people that are trying to go outside of their turn. And for example, in California, Governor Newsom actually put a mandate out there that if a doctor, for example, gives the vaccine to his wife out of turn, then he can lose his license completely. And he had tons of fines and loss of license and other things very seriously coming down on that person. So in reality there are no tricks to get yourself the vaccine faster. But if you do qualify, look for the places I mentioned. If you don't remember them or you didn't catch all of them, you're all more than welcome to message me through Facebook and I will always reply back. And I can send you those things in writing. I can even post it on my Facebook for everyone to see. So, you know, I'll put that out there, you know, as soon as it becomes a little more available in the next 7 days or so. And the other question was, can we transplant new lung to a person who got severe pulmonary embolism from COVID effect? Yeah, absolutely. So if, you know, one of the things that happens, unfortunately, with patients with COVID is that their lungs can get destroyed completely. So once the COVID infection is under control and inflammation is gone, you can actually put a lung transplant in them and then they can actually start functioning. It's just the question is who can get the lung transplant. Only very few people can get it, and it's very rare that this is happening right now. So it is possible in theory, but in practicality, it's not really happening. How would the world leaders guarantee to avoid another new pandemic, which comes from one of the other countries that so far has been involved in it? For example, we know SARS virus, both COVID-1 and COVID-2, both came from Asian countries. So how do we do that? You know, one of the things, you know, that's very important is destroying the rainforest. As we start destroying the rainforest, you know, one of the things that happens is a lot of the animals that used to live in the rainforest now have nowhere to go. They start coming in looking for places to live and coexist, which brings the distance between us and them closer to each other. And then we can get more things from them. That's one. Two is, you know, being more careful about exotic foods and animals, you know, that we eat. You know, I mean, it is the culture of some of the countries, you know. I'm from Iran myself, so, you know, we have some exotic taste that some of the other individuals may be like, oh my God, you know, what you know, how you eat that? And I say, yes, and it's delicious, you know. So we have to be all careful, you know, be a little bit more careful. But in reality, I don't think you're ever going to stop it. COVID-19 will not be the last of the bad infections. And in reality, thank God, COVID-19 is not as deadly as it is. Because imagine if the mortality rate was 30% and 100 million people would have got the infection. That means by now, 30 million people would have died. By now, 8 million people in the United States would have died. That would be a complete disaster. Our entire infrastructure would be gone at that point. So how do we prevent things? Number one is coming up with mRNA vaccines. It's very helpful because if a virus comes out, a new virus, we can now quickly decode their genetic information, make their spike proteins, the mRNA that codes for it, make an mRNA vaccine and give it out to the public. As we get better and better at this, we may be able to turn this around in a few short months instead of a whole year. And that will give us, get us ahead. United States, you know, we need to get better at producing our own things. When I was in the hospital in the beginning of the pandemic, we didn't have enough masks. I had to take my mask, you know, and keep it with me for a week to 2 weeks at times, just so I can protect myself, because we had to wait for China to make the mask so we can get the mask in the United States. It's a shame that the United States, a superpower, cannot make its own mask. So again, these are things that we can get better at, you know, getting better at making, you know, protective equipment so the doctors, nurses, the healthcare workers can be protected, coming up with better strategies for vaccination, coming up with, you know, more strategies on, you know, making sure that the wildlife stays where they are and they don't come close to us. And one of the main things that we can do for that is to stop the destruction of the rainforest, because that will bring all the animals closer to us, and that's going to cause a lot of problems for us. The other question is, how effective is the first dose of the vaccine? Not very effective. You need the second vaccine. And even after you got the second vaccine, you have to wait at least a week before you really are in that 95% effectivity. So yes, you may have some immunity after the first vaccine, but nothing close to 95%. That is the reason why they have the 2 doses. And so I would say to you that always get the second dose. Don't just get the first dose and stop there, unless you had a horrible reaction, you know, like an allergic reaction. And one thing that always comes up is, let's say you got the Pfizer vaccine. Pfizer vaccine is 2 vaccinations 3 weeks apart. So let's say you got the first dose and then something happened to you. You couldn't get the dose exactly at 3 weeks. You can get it up to 6 weeks after. So really, you have another 3 weeks afterwards to get the second dose of the vaccine. So don't be in despair and still get the second dose. And then still be very, very careful up to a week afterwards. And then you're definitely a little more protected, you know, after that. The question is, would you share these slides with us? Absolutely, I have no problem with it. I've sent one to Mohammed. Mohammed, you're more than welcome to share it with anyone that wants it. Is there any advantage of Moderna over Pfizer other than the temperature? A very good question. Pfizer vaccine needs a negative 69-degree temperature, so only special freezers are used to store it. So it's a little more difficult to store. Moderna can be saved in any freezer or freezer. There's really not much of a difference. They're both 95% effective. They're both very safe. The one difference is that Pfizer vaccine is approved for individuals that are 16 years and above. Moderna vaccine is approved for individuals only 18 years and above, which means if you're a 16-year-old or a 17-year-old, you can get the Pfizer vaccine, but you cannot get the Moderna vaccine. So that is the main difference between the two. Otherwise, they're very similar in every category. The one question is, my friends tell me that the second shot has more body pain and side effects. Is this true? Yes, it is. It could be true. What we've noticed is because after the first shot, your body makes some immunity. When you get the second shot, you get even a stronger immune reaction to the vaccine, which is a good thing because that means that your body is really working to come up with an immune response. The side effects can be body ache. The side pain is one of the number one things. Body ache, fever, chills, headaches. These symptoms, they are usually very transient. They go away within 48 hours. So yes, you may get a worse reaction after the second one, but it's only for 1 to 2 days and then it goes away. And it will never last longer than that. So everyone will be okay afterwards. My recommendation is maybe take a Benadryl before you take the shot, and then maybe an ibuprofen. If your doctor says it's okay, not everyone can take ibuprofen. If not, take a Tylenol, if that's okay by your physician, before you get the shot, and then take those again the night before you sleep, the same night that you get the shot. And sometimes that will help so you don't get as much of a reaction. But realize that the same reaction would happen to you if you actually got the same, the actual COVID virus plus a lot more, where you could die. So in reality, I'll take it having 1 or 2 bad days and then being protected. And so that's my suggestion for you guys. And then let me see here. The other question is, I don't think I missed any other questions. I think I've answered almost all the questions. I'll wait another minute or so to see if there are any other questions. If not, I appreciate you guys. Thank you so much for letting me talk about something that I'm very passionate about. My number one thing is to make sure that you guys are safe and that you don't get the virus and you get protected and that we get through this pandemic together. And it's going to be together. So, I wish us all luck and thank you so much. I don't think there are any other questions.
Yeah, I do have a question actually.
Sure.
Imagine someone is just exposed to the virus. Let's say I meet somebody who's sick today. Does washing mouth and nose help to protect me from getting to just wash the virus out, or does it not have any impact?
That's a great question. Anytime you can decrease the viral load, it will help. Has there been any studies that show effectivity of this process? No, but I would say this: does it cause you any harm? Absolutely not. Just don't do anything harmful. For example, the misuse of bleach, for example, has increased tremendously in the United States because of a comment that was made. We just want to make sure that if people are washing it, they're washing with water. They're not putting things that are harmful to clean up. Don't wash your eyes with bleach. I know it sounds silly when I say that, but it's happening. Or don't swallow bleach or other things. So yes, washing will probably not be a bad idea, but it won't. There's no evidence that it will help or not. But I would say more importantly, just make sure that within 3 to 4 days of that exposure, you get tested. And then once you get tested, if you're positive, seek treatment. If you're high risk, make sure that you get that monoclonal antibody. If you're lower risk, then still you can get some supportive therapy. And if you do get the infection, quarantine yourself so you don't give it to everybody else. And that's something that's being done very well in Asian countries. And we haven't done it as effectively here. And if we can do that effectively, we'll not only, we'll definitely save lives.
Yeah.
Yeah.
Thank you so much.
My pleasure.
I think there was one more question, but I believe you
Sure.
had already answered that. The question came, I think she was asking how long after vaccination you're safe to travel.
It's a great question. I would say you're safe to travel after 1 week after your second dose. And they're coming up with the COVID passports. I'm sure you've heard of it. A lot of cruise lines are now requesting it, that you either show your COVID vaccination passport or you get tested before you get on, on a cruise ship. Eventually, I think that's a great idea to do because, that way people that don't believe in vaccines, at least we test them before they get into a place where they can infect a ton of people. And the people that do believe in vaccines, they can get the vaccination and then they'll be protected at least, from that. So that would be a way for us to kind of go back to some of the normal things we like to do with the going on cruises and making the flights more safe and train travels more safe, those kind of things where we have to be in an environment where it's closed with a ton of other people. So that's I would wait for a week after the second dose.
Perfect. There are two more questions, and I
Sure.
think after that we can.
Yeah, I see one question here is, can we get the Moderna as first shot and Pfizer as second shot? That's a really good question. Since there have been no studies and they may be coding the mRNA for Pfizer and the mRNA for Moderna, may be coding for different spike proteins, it's really, really not recommended to swap, do one vaccination by Moderna and another one by Pfizer. I recommend strongly, and that's CDC guidelines as well, that if you start with Moderna, you finish with Moderna. And if you start with Pfizer, you finish with Pfizer. So that's this recommendation right now. And then there was another question you mentioned, but I don't see it.
I think one person was asking about grocery, how washing grocery helps or not.
Well, it will help. So when you get any kind of grocery, do a cleaning. A lot of people are doing that now, and they're cleaning the bags and the boxes. The chance of you getting it from grocery is very, very low, but it does exist. So therefore, why not be extra safe? Mm-hmm. So I would say there's no way you can 100% protect yourself in that way. The good news is that we've learned that if a virus ends up on a surface, any surface, within hours afterwards, it's no longer contagious. So it could anywhere between, a couple hours to 24 hours. So in reality is if something was touched within 30 minutes before you got it, and that person had the infection, then there's a chance that you could get the infection. So I would say when you open the boxes right away, especially if the grocery is being delivered to your house, then I would just make sure that I have my mask on, I have my gloves on, I clean everything, and then I go ahead and open the boxes, and then I can take my gloves off and go from there.
Right. All right. Thank you so